So I'm Grady Crosslin from Crosslin Creative Ceramics. We've got a lab in the Dallas-Fort Worth area as well as in Southeast Florida. I'm a certified dental technician, come from a long history of dental technicians. We are a Crown and Bridge specific lab with a heavy emphasis on implants. And especially with our Southeast lab, when we started it 3 years ago now, we tried to put an emphasis or cater to surgical practices, helping them provide services to the restorative doctors. Any company I choose to align with, I'm looking for similar quality standards from the people they hire all the way to the products that they put out. So the same research and background and material choices, I want them to be aligned with my own business. The reason why it's important to me as a small business owner, not having the funding to do my own research, that I lean heavily on manufacturers like Straumann to provide that scientific data to me on the research that they've done. As a lab, one way that I'm able to differentiate ourselves would be to give our doctors the guarantee that we're providing original components. Yeah, I mean, we used to use, I mean, even though we had an Econ scanner before, Straumann, so there was multiple times to where doctors couldn't get abutment seated for, whatever reason, and then me go chairside with the dental rep, and then the rep say, well, this isn't a Straumann abutment. And so maybe it was even tissue sometimes that wouldn't let the abutment seat, but having to answer those questions is why didn't you use a Straumann abutment? So those, that was one of the pivotal points of when we started to use original. So as well as, having a abutment loosened and the doctor spending an hour trying to dig the screw out, and then having the angry phone call of, the rep tells me this is an Atlantis abutment, why didn't you use a Straumann, I think 90% of the time the doctors ask for a titanium abutment, they don't ask for a Straumann abutment. So it's left up to the lab to do whatever they choose. And early on it was just easier to put something in a box and send it off to a company and get whatever abutment. It wasn't necessarily a price savings thing as it was a ease of use, but having Dion and other reps like that be able to have the confidence in me as a lab or us as a lab, really they have to know that everything that comes out of our lab is going to be a Straumann component. I feel strongly about using original components, primarily due to the fact of past experiences with difficulty seating third-party abutments, or some sort of failure, whether it be abutment loosening, screw failure, and wanted to ensure that my restorative doctors, surgeons, and the whole restorative team had that assurance that anything that came out of Crosslin Creative Ceramics would be an original component. As a team, I think it's very important that we're all on the same page. If the surgeon chooses to use a premium product like a Straumann implant, that they have the assurance that we put a Straumann abutment, Straumann screw on that implant to back up the lifetime warranty of the implant and ultimately the best patient care. I think one of the unique benefits of a laboratory having a close relationship with a surgical practice and the restorative doctors, that we get to function as a team with ultimately the patient care being the #1 priority. And we each can feed off of each other in our area of expertise, and it allows not any one person has to pull the weight of the other team when we're functioning as a unified unit. As a laboratory, to my surgeons, I'm able to provide anything from specific preferences to from the referrals that they may not be able to vocalize directly to the surgical specialist, down to materials. Speak about my own experiences in the lab and with other restorative doctors on non-original fits and things that I may be able to add insight to on potential failure points of materials selected. Some of the consequences of not using original components on Straumann implants would be possible screw loosening, screw breakage, screw failure, damage of the internal components of the implant, bone loss, implant failure. So us using original and original components definitely give our restorative doctors and our surgeons a peace of mind that we've done everything that we possibly can do, and Straumann as a company has done everything they possibly can do to back up their lifetime warranty on their implant and also their long warranties on their prosthetic components. As a certified dental technician, I think we're looked to as a resource for restorative options as far as materials. I take it personally to be able to educate my doctors on the consequences of using generic parts and pieces on a Straumann implant. So some of those consequences could be, ultimately patient satisfaction with our possibly skill level, or by having to come back in and have things repeatedly tightened. They look at implant dentistry as a long-term solution to tooth loss, and if we continually have issues and problems come up from generic abutments, breakage, screw loosening, bone loss, maintaining that original on original aspect, I think just at least gives the patient the peace of mind, the restorative doctor the peace of mind, and the surgeon also. So the ways that you can identify a Straumann abutment, that it's authentic, is by the logo that's etched into the internal connection aspect, as well as the lot number. A key feature to the CrossFit connection that Straumann has developed and engineered is that the basal screw will not engage the threads of the implant until the abutment's fully seated. So even though sometimes they may take an x-ray to verify that, it's not needed with the CrossFit connection on the bone level implant.